This is Abia COVID-19 update. Abia COVID-19 update.
Children and young adults are not as likely to get severely ill or die from coronavirus, that's the novel coronavirus COVID-19, as older adults. But they have an important role in stopping its spread and keeping those who are most vulnerable from getting sick. We are all in this together. We all need to practice social distancing, and that includes children, young adults, and the rest of us. The more we can slow the spread of this virus, the more lives we can save. It is clear, if this virus spreads quickly, it will likely overwhelm our healthcare system in terms of availability of hospital beds and availability of ventilators. So it's crucially important to slow the spread of this virus, and that's everyone's responsibility.
More people are infected across the world. You would have seen the numbers, 10 million. It's increasingly obvious that transmission among younger people, really, not children, but people aged between 20 and 40, as far as we know, are really driving the spread of this virus. But those that are bearing the brunt of it are people aged 50 and above. 3 out of 5 people who die from COVID-19 are 50 and above. So we have to work harder, all of us collectively.
Well, the voice of the Director General of the Nigeria Center for Disease Control, NCDC there, Dr. Chikwe Hiekwazu, calling on Nigerians to show more love and care towards the elderly citizens, as majority of COVID-19 fatality were recorded among this category of people. He said that despite the fact that young people are a major driver of the virus, the elderly are the ones paying the price most of the time. The NCDC boss, that's Dr. Chikwe, also warned youths to be careful, adding that older people from 50 years and above are the ones mostly dying from this disease. It's unfortunate, as the virus has not changed, but we have changed our behaviors.
This is Abia State COVID-19 Update, the first edition for the week. My name is Chioma Nkwanta.
And my name is Michael Oni. I'm reporting live today from the testing laboratory here at Amachar. I'm very much live in the laboratory with the man in charge, the doctor in charge of the laboratory. And later on, we will also upload the video of what the laboratory looks like on our YouTube page. Chairman.
On this program, we highlight daily reports of the Inter-Ministerial Committee on the Control of COVID-19, as well as Abia State Governor Okeze Ikpeazu's efforts in ensuring that the state is safe from the virus. It is running simultaneously every weekday, from Mondays through to Fridays on several radio stations in the state. We are live on BCA 88.1 FM, here at Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We are also live on Boz 89.7 FM and Rail 99.1 FM, both in Aba, the commercial capital of Abia State. Over to you, Michael.
Well, let's run through the figures now, and of course some of the developments across the world. The global number of deaths is standing at 536,900 as at 8 a.m. today. Meanwhile, the total number of infections worldwide stands at 11,564,515. Also, the number of recovered cases is at 6,539,030. India as a country has taken over Russia to become the third worst affected by the virus after reporting 248 new cases. Yes, Chairman.
Okay, Michael. Nigeria's tally of confirmed COVID-19 cases rose to 28,711. As at last night, we had 544 new infections. They were announced by the Nigeria Center for Disease Control (NCDC). 11 deaths were recorded from the virus, bringing the total number of confirmed deaths from the virus to 645. The 544 new cases were reported in 19 states. We have 19 states: Lagos with 199, Ebonyi 65, Oyo 47, Ondo 46, Ogun 31, Edo 30, the Federal Capital Territory with 28 new cases, Katsina with 25, Plateau State had 15, Bayelsa 11, Kaduna 10, Adamawa State 10, Akwa Ibom 8, Kano State with 4, Taraba 3, Rivers State had 2. Here in Abia, we had 2 new cases, and Ekiti 1. 28,711 cases have been confirmed. There are 16,401 active cases of COVID-19 in the country. 11,665 cases have been discharged so far, and 645 deaths have been recorded. 151,121 samples have so far been tested. Michael.
Well, it is important to note that the resumption of domestic flights and interstate travels might pose a threat to its fight, the fight against the spread of this virus. While interstate travels officially began last week, the Nigerian government has announced that domestic flights will resume on the 8th of July. So experts, however, are warning that the step might be disastrous if social distancing and other safety protocols are not adhered to. So it is important that we keep following some of these protocols. The action by Nigeria and other African countries necessitated the World Health Organization to call on these African nations to take effective measures to mitigate the risk of the surge in COVID-19 on the continent. So the regional director for Africa, that was over the weekend, said that while opening borders are vital for free flow of goods and people, initial analysis by WHO found that lockdown along the public health measures reduced the spread of the COVID-19. Now, straight to the discussion for today. I told you earlier on, Chioma, that
Yes.
I'm very much live in Amachara here at the NCDC approved laboratory for COVID-19 tests. And of course, I have the man in charge of the laboratory very much here. And of course, I can see some of the equipment here inside the laboratory right now. I have Dr. Okorie Onuka very much with me. Good morning to you, Doctor.
Hey, good morning.
Well, what a privilege. Will I call this place a red zone? Is it a red zone?
Actually, it's a red zone. And we don't give the opportunity because we really need to sensitize the population about what is happening in the laboratory.
Testing is very crucial to management. It's a kind of test that you get to understand if the person is positive or negative, then you take it up from there. How do you go about this test? Do you also take the samples, or the samples are brought to this laboratory?
The samples are brought to this laboratory by the scientists that are in the field collecting the samples. So they are brought to the lab through the biosafety cabinet. That is in the biosafety cabinet. That is where they process. Like I said earlier last week, there is the 2-bench process.
Okay.
After the processing, then they will inoculate into and then are brought to the gene expert room, where the gene expert will now process the sample.
The room we're here right now
The room is the gene expert room. Before the sample are brought to the gene expert room, there is another processing room. We call it the BLS2 lab. And it's the BLS2 lab, that is where the samples are processed. If you don't have the biosafety cabinet, you will not be able to process the sample. So the biosafety cabinet is very, very important, and it has been satisfied by NCDC before we started testing in Abia State. So after processing in the biosafety cabinet and inoculating into the cartridge. Then it's brought into the gene expert room and loaded. Actually, the gene expert room is a clean area, while the biosafety lab is a dirty area.
Oh, interesting. Now, I know that there are two types of tests approved by WHO and also NCDC used in Nigeria. You mentioned the gene experts. Which one is the other one?
It's the PCR analysis.
Okay.
We still have the platform for PCR analysis. We're still waiting for the NCDC. Not approval. Approval will be made. It's just for them to come for the activation.
Okay. There is.
They will have all
there
it.
is activation.
There is approval. There is activation. It has been approved already because we have all that is needed. We have the real-time PCR machine. It's a 6-bench process, like I said earlier last week. We also have all those 6 benches for processing the sample through the PCR platform. So we're just waiting for the activation by the NCDC because they have to do some trainings and also bring the commodities that we need to start.
I can see the computer system connected to Genius First machine. How does that work?
That is one of the components of the Genius First because once you load, everything after the loading, everything now becomes automatic.
Interesting.
And as the result is being generated, we are not the only people seeing the result. Even the national program they're seeing. And I don't know if they are linked to the NCDC, but we use it for the national TB control program. Okay. So they have a platform where as the result is coming out, it's also reaching their dashboard.
Interesting. Per samples, how many samples do you test at a time with this machine? I can see 4 pull-ups.
Yes, it's a 4 modular machine.
Okay.
Every 45 minutes, you get 4 results.
Every 45 minutes, you get 4 results. Are there tests going on right now?
Let's see. There are tests going on in the next 45 minutes. And like one of them is remaining 23 minutes. The other one 19 minutes. Another one 21 minutes.
So it means in let's say approximately 25 minutes. In 25 minutes, we'll be getting another result, 4 new results. Now, do you work 24 hours here in this laboratory?
Yes, we have the capacity to work 24 hours.
Interesting.
Yes.
What about power supply?
Yes, we have. It's connected to the national grid, and also have a 165 kVA generator system.
Now that Abia has a laboratory, how many samples have we been able to test, and how many came out positive? How many came out negative?
Since we started with the gene expert testing, we have tested 224 samples. And out of that 224 samples, 75 were positive and 90 were negative. They will have 6 errors and 3 presumptive positive. So the presumptive positive, they are inconclusive. So what we do for this one is just to repeat the test. So far we have 75 positive and 90 negative out of the 224 samples tested.
Now, there are issues of lab operatives, healthcare workers testing positive to coronavirus. It has happened in several states. I can see that there are so many procedures you go through before you get into this laboratory. Can you run us through those procedures again?
Yes, none of us have been infected in the lab in the United States. Like I said, we have been using this gene experts for the past 3 years for the diagnosis of tuberculosis and multi-drug tuberculosis. And there are safety protocols that we have adhered before. Even the TB is even more infectious, not more infectious. So what I say, we have the multi-drug resistant TB. That is, I won't say it is more infectious. It's resistant to drug and TB is airborne and easily. So what I'm just trying to say is that TB is airborne, while the COVID-19 is droplet. So it is easy to get infected with TB than the COVID. But there are safety protocols that we have been adhering so that we don't get, and none of the staff that are working here have been infected with either TB or COVID-19. And when I started, I told you that the biosafety cabinet, that is where the processing takes place, and the bacteria has many components: the UV light and the negative pressure and all the rest of them. So the biosafety cabinet is where the processing is done, and that is where they inactivate the virus. So if you don't have the biosafety cabinet, there is nothing, and everybody will get infected. And that biosafety cabinet will only work when there is light. So it's also connected to solar system, so that as they are processing the sample, the light doesn't go. Even if the NEPA goes off, or the gen is switched off, we'll have a solar system backing the biosafety cabinet. So anybody working, immediately the light goes off on the biosafety, the person has to run away. So we'll have safety measures that have been adopted by the staff, and that is why they are not getting infected.
Oh, that's great. Chairman Concha, can you hear me?
Yes, I can.
All right. I would like you to open the phone lines for the listener to ask questions concerning the laboratory. We're very much live in the laboratory right here on several radio stations in the state. And I'm sure you have questions also to ask Dr. Okolie this morning.
Doctor, how long will the test results, how long is the waiting process before we get at the test results? And then the second question is, how many times would one get tested before you're certified COVID-19 free?
Okay, the test will take only 45 minutes to get the result.
Okay.
And like I said earlier, it's a 4-modular machine. So every 45 minutes we are getting 4 test results. Okay. Then for the management, I'm not managing. It has to do with the case management team to determine when the person, how many times the person will test before. There are different protocols now. Earlier, the test was to test 2 after 14 days. Then after some time, the NCDC said that it will be 1. Then they came out with another protocol that if you have been managed for 14 days, that you are free to go. So these are all protocols coming from NCDC. Okay. So, but the case management unit, I think they can decide whether the person have to do 1 test or 2 tests or to go after 14 days, especially if the person is asymptomatic. Okay.
All right, I'll open the phone lines right now. The numbers to call to ask questions pertaining to the laboratory in Amachara: 0808 1826 949 or 0811 6052 949. Hello. Okay, we lost that call. 0808 1826 949 or 0811 6052 949. Good morning. Hello, good morning.
Hello.
Yes, good morning.
Yeah, good morning, Chioma.
Good morning to you.
Good morning, Michael and the doctor.
Hey, good morning to you. Good morning.
I must commend the Flow FM for what people are doing. I must commend Michael Oni for taking this bold step to bring to the people what is really happening. I wish our people will listen. Our problem still remains the attitude of people towards this disease, disrespect to government directive, health expert directives. That remains the problem. But doctor, you are only person, you are not managing. Otherwise, I would have asked those that without any form of symptom, can it, can they recover without any form of treatment? Thank you very much.
All right, thank you. Michael, did you get the question?
Okay, Chairman, we didn't that.
Yeah. Oh, he said those.
Please, can you relay the question again?
Those that do not have any, that are symptomatic, can they recover without any form of treatment?
Okay, those that are symptomatic. It's a viral infection. Because it's a viral infection, there is no specific treatment for it.
Okay.
But what we advise is that if you are infected, then you report at the treatment point. At the treatment point, they know what to do for you. There's what we call symptomatic management.
Okay.
Maybe some people have fever, then the fever has to come down. They have to do one or two things. But you have to, the most important thing is isolation. Then you have to be isolated so that you cannot infect other people. So the protocol for management, all that they do in the isolation center has to do with the case management. And they are actually doing something for the people that are being managed.
Okay.
So for those that are symptomatic, in line with your question, that can they get well without management? Yes. We don't advise anybody to stay at home. But you really need to go and meet the management team. They are the people that will assess you and now know what to do for you. Because if you decide on your own, because I'm not showing any symptoms, let me stay at home. Because it's a novel virus, nobody actually knows the pathogenesis of this sickness. So you may not know, anything can turn around at any time.
Okay, doctor, there is this very important question I want to ask you. There is the belief among our people that coronavirus in Nigeria is not as genuine like the one we have in some countries because of the pictures we are seeing. And they are saying what we have here is just normal malaria. No, from your angle as a scientist, you will be able to differentiate between coronavirus, especially the one in Nigeria in goat, and the malaria, because what we have now, we have so many persons falling sick, and they are not even coming out for tests.
Yes, it's the same virus. They have done the gene typing. The gene typing, the essence of gene typing is actually to know if the virus are the same. So they have done gene typing and they have linked it to the same virus that is also ravaging people outside there. It is clear that the statistics, if you look at the statistics in UK, if you look at the statistics in America, you see that Africa is the least affected continent. So, but it is obvious that we have COVID-19. So it's the same virus. So but the fatality and the infection rate here is low when you compare it to other developed countries. So there are drivers of, or what we call the determinants of sickness. It may be socio-economic, it may be genetics. There are many things that determine the impact of a sickness in somebody's system. So there should be the myth that the virus over there is different from should not be entertained. They should know that, and we are still having fatalities. And the fatalities is also taking the same pattern. The young people are more infected and the elderly suffer the fatality.
All right, Chema, can we take more calls, please?
All right. Good morning to you. Okay. 0808-1826-949 or 0811-6052-949. Good morning. Hello, good morning.
Morning.
Hello, what's your name? Good morning. Hello, good morning. Okay. Good morning to you.
Good morning.
What's your name?
My name is James.
All right, James, go on. Quickly, you have 30 seconds.
Okay. What I wanted to comment is that we thank you for the quick recovery of our governor. We say of all our patients that is in the hospital, God will lead them in Jesus' name.
Amen. Thank you very much, Michael. I think that
okay, that sounds like contribution.
Yes, with this last call, we are done with the Abia State COVID-19 update.
All right, thank you very much, Obari. I want to thank Dr. Okorie Onuka and also Stanley. The video will be live on our Facebook later on today. Many thanks to Stanley also, and also Ifeanyi for making our transport here possible. My name is Michael Oni. Stay safe and take responsibility. Chioma.
Thank you so much, Michael. Thank you to all our partnering stations, BCA 88.1 FM. Here, Flow 94.9 FM, Vision Africa 104.1 FM, Boz 89.7 FM, and Real 99.1 FM. COVID-19 updates will be back tomorrow, same time at 11 a.m. Thank you so much for listening and enjoy the rest of your day. I am Chioma Nkwanta.
This is Abia COVID-19 update. Abia COVID-19 update.